All right, it is 2:30, so I'm going to kick us off. Welcome everyone to this session of the 2024 Culture of Data Conference. Thank you for joining us. I'm Lala Kaiser. I use she, her pronouns, and I'll be moderating the session. We also have Peggy, who also uses she, her pronouns, managing our Zoom and making sure all of the technology is working correctly. Everyone should be muted right now, but at the end, when we have our Q&A session, feel free to unmute, and I actually encourage you to unmute and ask questions. And then you can also use the chat box, and I'll read your questions out loud. If you are comfortable doing so, please add your pronouns to your Zoom name by clicking the three dots above your video square and selecting rename. Now, to get us started, we want to thank our generous sponsor, Champ Software, and we want to thank them for their contributions to the Culture of Data Conference. I would like now to invite David Smith from Champ Software to say a few words.
Hello, thank you for coming. I'm going to share my screen and just talk a little bit about what we do. And I've been with Champ Software for 20 years. We really have been serving the public health industry from 1985. And what we're going to talk about today is Nightingale Notes. It's our EHR that was specifically and exclusively made for public health. And we've always wanted to do visualization of data, so that's why we sponsored this conference last year and this year. We also believe that you should be collecting that data before you visualize it in a standard terminology so you can share it with others. The American Nursing Association has approved 12 standard terminologies, but only 3 support point of care nursing, and only 1 supports interprofessional practice and contains all 3 components of a standard terminology. The benefits of a standard terminology is that you have consistency, you can build standards of care for the populations you serve, and you can have reliable data. As far as we know, we are the only vendor who offers a public health EHR that has an American Nursing Association recognized standard terminology in it. And ours also includes social determinants of health and evidence-based clinical outcomes for all client types, even if that client is the community, a family unit, a non-family group, individuals. And the other unique thing about ours is that every area of nursing focus are mapped to SNOMED CT, so you can share that data with medical providers. Today, our topic is visualization of your data, so we're going to show how that happens in Nightingale Notes. We're looking here at our outcomes, clinical outcomes. You'll see in each of these graphs, there's 3 bars. And what we're measuring is 3 different outcomes: the knowledge that client has about this focus area from their initial visit to the latest, their behavior as it relates to that focus, and their status, signs and symptoms that relate to that focus area. There are 42 focus areas that cover all of the human existence. The other way we visualize data is in all the other areas: financial, cost centers, time by service, aging balances, enrollments in your programs, and your cost centers. And thank you for giving me a few minutes to talk about what we do today. And you can find our information, I think, in the conference information to get a hold of me or someone else there. So again, thank you for your time, and we hope to hear from you.
Thank you so much, David, for joining us for this presentation, and to Champ Software for sponsoring this session. We have one presentation during this session. It will be approximately for 25 minutes, and there will be 10 minutes for Q&A afterwards. During this session, we will learn how the Center for Improving Value in Healthcare creates interactive dashboards in order to disseminate data from the Colorado All-Payer Claims Database. Specifically, our speakers will address how they make big data and analytics accessible to the largest audience possible. And as a biostatistician, I'm very excited for this talk. So now I'll turn it over to Carrie and Ryan to present Considering Accessibility in Visualizing Big Data. Thank you for joining us.
Thank you so much, Lala, and thank you for everybody who is participating in this session today. Hopefully, if you're in Colorado and it's gloomy where you are too, we'll brighten your day a little bit with some visualization excitement. Hopefully, this will be a fun session. We definitely want it to be interactive and hear from you. My name is Carrie Frank. I'm the Vice President of Communication and Marketing I use she, her pronouns, and I am joined by Ryan Smith, who is our graphic designer extraordinaire. I'm going to kick us off today really quickly, just go through who Civic is in case you're unfamiliar with us. We are a nonprofit organization who is really dedicated to equipping partners and communities in Colorado and across the nation with resources, services, and unbiased data, which we're going to talk a lot about today, needed to improve health and healthcare. And ultimately, our vision, if we achieve our mission, is that everyone has the opportunity to be healthy and has access to equitable, affordable, high-quality healthcare. And we do pride ourselves on being very service-oriented and independent and objective. We serve a variety of folks who we call change agents. Those are individuals, communities, and other organizations who are all working to make healthcare better and to make Coloradans healthier. Those of you on the phone are a huge part of that. So thank you to all the public health folks out there who do amazing work. We work with clinicians, government agencies, nonprofits, researchers, employers, hospitals, health plans, you name it, anyone in like the healthcare stratosphere who is all focused on the consumer that you see there in the middle. We also serve consumers through some of the information that we provide as well. So today we're going to be talking about the big data that we have, and that comes from the Colorado All-Payer Claims Database. We are the administrator on behalf of Medicaid in Colorado. We collect claims on a monthly basis from over 48 commercial payers, Medicaid and Medicare Advantage and Medicare fee-for-service. So it is across a wide swath of those folks who are insured, which is about 5.5 million lives in Colorado, represents over 70% of the medically insured. We have over 1 billion claims in the database. That's just from 2013 to 2022, but we do collect monthly claims. So we have data that's even, a month old at this point. What we don't have is federal programs. We can't collect VA, TRICARE, and Indian Health Services at this point. We don't get anything that doesn't have a claim, so we don't get uninsured, or anything that was paid out of pocket. And then we have limited ability to collect the ERISA-based self-insured employers. Those are like very large employers that self-insure their employees. We can only voluntarily collect those. So we have a handful of them, but not all of them. And what we do is we make that data publicly available, which is what we're going to talk a lot about today. We have a ton of information on our website. If you go to civic.org, feel free at any point in time. We have a shop for a care tool that helps people if you need knee surgery or shoulder surgery or an imaging service. It'll tell you how much it would cost at different locations across the state, and we marry that with quality data as well. We have things like low value care analysis, a health equity analysis that shows the impact of social factors on healthcare access. And we have a community dashboard that has a wider range of wide array of information, measures across cost of care, quality, access, and utilization. That's just a handful of the many things that we have available. And then we also have a lot of non-public data that we provide on an annual basis, about over 100 requests that we fulfill from researchers, from state agencies to address specific needs and initiatives. So with that, the challenge that we have, especially on the public side, because of all the audiences that we have, is making the data accessible and inclusive to everybody who might stop into our website to check it out. So we have just the general public who might be interested in just understanding what's going on in healthcare, what we're trying to do to improve it as a state, what the data might be showing. We have employers that might be coming to understand how they can improve healthcare costs and wellness with their employees. We have providers that run the gamut from hospitals, practitioners, public health, who might be looking at it for benchmarking to see what their prices compare or how their community might be faring in quality measures. Also serve a lot of state agencies who are looking at policy and things that they can do to address rising healthcare costs, for example, and rising pharmacy costs. And then we have a lot of researchers within Colorado and externally to Colorado who come to the APCD in our state because not a lot of states produce information like we do and have non-public ability to access the data. or public data. And so they're looking at what information is available in APCD that they could conduct research on specific disease conditions and things like that. So we have a lot of people trying to use it for a lot of different ways. And that is what our challenge is. And our goal is to make it accessible and actionable and inclusive to anybody who may come and look at the information. So we want to make the data easy to understand, complex topics. It gets pretty weedy out there in the healthcare world. We know that. This audience knows that. And we want to tell a story and highlight the issues and findings that we are seeing, make our interactive data options meet the needs of the multiple audiences, no matter what you might be looking into. Maybe you only want to look at Medicaid population. Maybe you only want to look in a certain county, but we have to make it available and useful for a wide swath of audiences and use cases. And then we want to also make sure that no matter who is coming to our website, regardless of their background or circumstances, that they're able to interact with the information and understand it and digest it. So why does accessibility, inclusive design, and content even matter? We have at least 16% of the world is estimated to have some sort of disability that equates to over 1.3 billion people. 75% of those folks are interacting on the internet daily, and only 4% of the websites out there, the top websites out there, actually have web pages that are accessible. We did a website accessibility thing, and that's not what we're talking about today, but we did that a couple years ago, and we found 3,000 instances of inaccessibility on our website alone. That was not even counting data visualization and things like that. So it's a challenging area, but something that we all need to be thinking about and focus on. Before I go any deeper, though, I want to just do a word of warning. We aren't experts in this, and we are continually learning, and every day we improve and get better at this. And so if you go on our website, some of the things that we're going to be talking about today, we didn't implement until recently. And so you might find some things that you're like, they could have done this differently. And we agree, and we're constantly always improving. And we will we would love to learn from this audience too. So please share at the end if you guys have suggestions and things that you've been looking into. So just some structure of like how we put information out that I think is just some guidelines that we use to make complex reports more accessible. And if we have time, I'm going to show you one of our website pages that does this. For every topic and every data set, what we try to do is just put a general description. What does the report include? Why does it matter? Put some considerations, because the APCD is a limited data set. So every data set has its limitations. So what caveats should people be going into the data understanding what they're looking? It helps just the user understand what they're looking at and what they're not looking at. We provide use cases. So I mentioned all those different folks that might come to our website. So we say, consumers, you could use this to look for healthcare prices to find the lowest cost, highest quality provider. Policymakers, you could use this to understand price variation across the state and maybe consider policy that would address price variation, things like that. We usually provide an interactive data set. So that's either a Tableau interactive, nice visualization tool or Excel. And usually if we have a Tableau report, we also provide an Excel spreadsheet, because that allows users to dig even deeper and to run some of their own analyses depending on what they're looking for in their unique set of questions. What Ryan's going to talk about a lot today is infographics too. So the key findings that we have is not everybody has a chance to dig into the data and to figure out what's the so what and what's the aha moment of the data. We want to highlight that for people. So we look at it from like a statewide level and then dig deeper, and then we create infographics that visually highlight the findings in a clear, concise way. issue briefs too. So if it's a complex topic like drug rebates, for example, or alternative payment models, which not a lot of people understand, we will provide an issue brief about why that topic is important, give some background and relevance, talk about how the state potentially is working on it, things like that, give people some perspective of what the issue is and why it's important. And then we always provide additional resources on the side of our pages too that give detailed methodology for people who want to dig into the weeds about how we develop the data, that provides this option to download the underlying data. And then if we have webinars or other resources, we'll include those as well. And with that just kind of background, I want to turn it over to Ryan to dig into more of the weedy how-to on his end. So jump in, Ryan.
All right. Thanks a lot, Carrie. And thanks everybody for joining us. I'm super excited to talk to you about some of the ways we're implementing accessible and inclusive design into our data visualizations. So before I get into the principles and strategies of accessible and inclusive design, I think it's important to give some context as to what they are. And I have a few analogies I like to use, so hopefully they resonate with you. So for accessible design, I want you to imagine a building with stairs as the only entrance. So this building is inaccessible to people who use wheelchairs or have difficulty with stairs. So accessible design is like adding a ramp to the building. The ramp provides an alternative way to enter the building, removing the barrier for wheelchair users. In inclusive design, I want you to think of a television with dozens of buttons, each with a specific function. This can be confusing and difficult to use for anyone, especially people who are unfamiliar with controls. Inclusive design is like creating a universal remote with clear labels and intuitive buttons. So now the remote is easy to use for everyone, regardless of age, technical expertise, or physical abilities. So getting into it here, choosing the right chart type, the right type of chart. I know a lot of times I usually just default and want to jump right in and throw a bar chart in to use for any type of data because that seems to read really well, but there are strategies to picking the right types of charts. But before you pick the right type of chart, you really want to understand the data, the type of data, the message or insight you're trying to convey. So for example, is your data numerical or categorical? Is your message about comparisons or trends? So once you start to answer these questions, you can start to explore chart options like bar charts for comparisons or line charts for trends and scatter plots for relationships. So in this example here, we're using a line chart to show the trends of low value care services by payer over time. So I just want to talk briefly, just going beyond the chart type, some of the things that we're doing in this example to really kind of go the extra mile to ensure inclusivity and accessibility for the user. And you'll notice we're using color in the key for the payers. But in addition to the colors, we're also using symbols to help differentiate the payers. And not only does this help the average user in separating the payers and zeroing in on the trend they're looking for faster, but it really helps users with visual impairments. So for example, if a user with visual impairment comes to this visualization and they're having a hard time differentiating between the colors, they can leverage the shapes to help differentiate. And that's something I'll get into a little bit more later, but that's just something important to call out. And it really is an easy step to take to help communicate to more of your audience. So next we're going to talk about prioritizing clarity and simplicity. So really this is all about reducing the cognitive load for the user. And when I say cognitive load, I'm referring to the amount of information our working memory can process at any given time. So with that said, you always want to be thoughtful of how all the elements in your visualization affect the user's experience. And you always want to ask yourself whether they aid in communicating your message or distract from it. So for this example here, we reduce the messaging and bar charts down to their most essential information and elements, clear, concise language, and no distracting decorative features. So really this in combination with an intuitive layout, an ample white space, and other design touches, it really can go a long way in reducing that cognitive load for the user. Next, we'll talk about embracing color accessibility. This is something to always be mindful of. You really want to ensure the colors you're using are of great contrast. Really, viewers that are looking at your visualizations that have visual impairments often struggle with contrast issues, and sometimes colors that look different for us look the same for them. So not only do you want to test your color palette, ideally it already has been tested and there's rules set up for the best ways to use it for communicating your messaging, but you also want to go the extra mile again and provide an alternative way for those with impairments to differentiate the information being presented. And in this case here, we've done the simple touches of diagonal lines going across the top part of the graphic. So somebody looking at this that has a visual impairment that can't differentiate between the colors can identify that one set is marked this way and the other is not, and that's how they'll be able to differentiate it. So crafting clear and concise labels really helps bridge the gap between the data and the viewer's understanding. So you really, or we, and you, if you want to be addressing accessibility and inclusivity, really want to focus on simple and direct language, avoid technical jargon and overly complex wording, use clear, concise language that everyone can understand regardless of their background knowledge, and really focus on the essential. So labels should convey the necessary information without being overly lengthy. They should prioritize what's crucial for understanding the data, and also consistent terminology. So you want to maintain consistency in terms and abbreviations throughout your visualization, and don't introduce new terminology without explanation. Lastly, font choice and size is very important. You want to opt for easy to read fonts and a size that's appropriate for the size of your visualization, and really try and avoid decorative fonts that might be difficult to decipher, such as cursive. So as Carrie mentioned, we have a very diverse audience. We're always exploring new ways to tell the story of our data to as many people as possible. Some of the ways we're doing that is by incorporating data and text into our visualizations. So we're combining charts with clear explanations, clear text explanations to cater to both visual and text-based learners. We're exploring illustrative and decorative elements. Now, this is something you need to be very cautious of. You really need to find the right balance when you are incorporating visual decorative elements or illustrations, that they're fitting with the concept, they're really furthering the story that you're trying to tell with the data, and they're not distracting from it. Also, it's really important to include, in this case, an interactive element. So really a way for users to interact with the data in multiple ways. And in this case, it's as simple as having a little call out on the right where the viewer can click to view the health equity analysis. So if they aren't getting the takeaway or they're not learning from the visualization in the best way for them, they have another avenue to explore to satisfy that need. You'll want to always be mindful of language independence and utilize universally understood charts and symbols that transcend language barriers. And in this case, really, it's as simple as calling out the up and down arrows. That's something that's universally understood, regardless of your background or language. And lastly, cultural sensitivity. Really just trying to be mindful of cultural norms and avoid colors or symbols that might have different meanings in different cultures. So ensuring accessibility for all, this list gets into a little bit more of the technical things you can do to address accessibility. And I feel like by naturally addressing accessibility, you're also helping to address inclusivity in the design as well. And I'll just kind of comb through these. Alternative text. Now, alt text allows you to describe images for visually impaired users. So not all the time, but sometimes in the infographics we use, or definitely on our website, we're using images that have text embedded into it, which I don't recommend doing. There's sometimes you just can't get around that. But in these cases where we're using images and a visually impaired person is interacting with our dashboard or our visualization, and they're using a screen reader or some other type of assistive tool, as this tool is helping them understand the content on the page by reading the text for them and combing through the headers and all the other information. If you've set up your dashboard or visualization properly for accessibility, it'll get to that image. And if you set up your alt text, it'll provide them with that information. So that's crucial, not only with images, but even if you're using charts that still have live text on them, you might want to go the extra mile and break down really what's happening within that chart within the alt text, just to make it easier for the viewer or the user. And with that, you really want to avoid jargon and technical terms and use language that's easy to understand, and try and keep it short, roughly under 250 characters. Keyboard navigation. So we know not everybody relies on a mouse. So keyboard navigation allows users with screen readers or assistive technology to move through the visualization and interact with elements. And this is something also the developer or whoever's responsible for the visualization or the graphic and accessibility for that matter to set up within the programs that he or she is using to build out their accessible visualizations. Screen reader capability. So this is really testing with screen readers and ensuring users with visual impairments can access information through audio descriptions. Focus indicators. This really helps users with impairments understand where they are physically on the screen or the visualization. So it's essentially highlighting. And this is also something you set up within the tool or program you're using to build these out. Responsiveness, ensuring these visualizations and dashboards look good on all devices, and clear instructions. If there is a way that you want to communicate, a better way to navigate your dashboard or infographic, you can set up simple text messages or a link to a dedicated page that helps people understand those ways to do that. So with that said, I am inviting all of you to join the inclusive and accessible data visualization movement. And really, that just involves contributing by sharing your expertise, learning from others, advocating for change, or even developing accessible tools. And really together, by doing these things, we can empower everyone to participate in data-driven conversations, unleash the true potential of data, and build a more equitable future for data visualization. So quickly, we have a resources and getting started page. So I really encourage you to check this out and educate yourself and utilize the resources here to help implement and make your visualizations more accessible and inclusive, and really open up your message and your communication to a much bigger audience. This is where you can reach us. We'd love to hear from you. Like Carrie said, we're very open to communicating and brainstorming and collaborating on ways to push forward accessibility and inclusivity in really all things, especially data and data visualization.
Great. Thank you both for your presentation. Does anybody have any questions that they would like to kick us off with? Feel free to come off mute or put it in the chat and I will read it out loud.
Sure. I'll go if that's all right.
Thank you, Dennis.
Sure. Thank you, both Carrie and Ryan. Thank you very much for giving us all this wonderful information. And it's not coincidental that this is something we're all having to deal with right now. And you mentioned this specifically, Ryan, and this is one of the thoughts I've had is when we're using platforms like Tableau and the rest, and you talk about alt text, in a lot of cases, it's common and also expected by some of our end users, which, as you noted, can be a nightmare for meeting accessibility needs. So I was trying to think of this as a backdrop. Can you tell us of a conflict that you or clients might have encountered between user expectations and accessibility needs and requirements, and whatever might have come up from that conflict?
Okay, so I don't know if it's necessarily, well, a conflict, but maybe in terms of the alt text, I guess specifically, really narrowing down the message that you're communicating visually in a concise way to present it via alt text. And that's always a challenge. It's really hard to put yourself in the shoes of a visually impaired user or a user with disabilities. So that's definitely a challenge that comes up all the time. And we are always analyzing how we are communicating that and going through the channels within our group of reviewing it and trying to run that through different lenses. But really that one sticks out to me in particular. It's really, how do you sum up a picture? You know, a picture's worth 1,000 words. So it's like, you know, how do you shave that down to something concise that'll fit within the constraints of alt text for the user that needs it? And really, my answer to that is really it's a group effort. I've relied heavily on the rest of my team within the communications group here to really help you know, just review the information we're doing, and that's really key, reviewing it and testing it. So not only getting that information tight so it reads well and it's understandable, but also testing it technically so it actually works when the screen readers encounter it.
That's precisely what I was thinking. And I say that because this is a struggle that multiple people have had here at the state as well. So you're definitely not alone, especially now we have the requirements along with it that are we have. And one of the things we talked about is seeing where we find people who have these accessibility concerns and then bringing them in wherever possible. Because you're right, we're not going to be the experts in this, no matter how good we are at data analysis.
And that's
I'm a
actually,
data guy, so yeah.
If that's an option, that's a great way to do it. You know, do focus testing on your content, and that's, I mean, a really great way to do it. Unfortunately, that's just not always an option. But if you have that at your disposal, I fully recommend it.
Agreed. It's just that alt text one was a roadblock because we have so many Tableau dashboards and they all have the tooltips on there. And what do we do? So I didn't know if anyone else is seeing that. That's really where it came from.
Well, you can reach out. I'm happy to continue the conversation on that one.
Oh, I very well may have to. I did keep up your information here, so thank you both very much.
Thank you.
Tableau is a challenge for sure. We struggle with that, and I think that that's also why we put so much information out around our data that is not just a Tableau report stuck on a page, that at least someone could understand some context, maybe look at the infographic, download an Excel file if that's more accessible for them. But it's a challenge when the software tool that you're using is not keeping up with the accessibility and inclusivity standards that you're holding yourselves accountable, and you're kind of like, well, that's the tool we picked. And so it's a limitation for sure. Would love to If you ever find a solution, let us know.
Good luck to us all.
Great.
Thank you.
I think I saw someone pop off mute. Does someone else have a question? I didn't get to see the name. Maybe not, but I do have a question. So I teach intro to programming here at the School of Public Health. And part of my class, a very small part of my class, is data visualization. And so if I had one lecture in which I'm trying to teach people how to code up figures, what are like one or two things that you think are like the most important in terms of accessibility that are like, you absolutely have to do this?
So in describing text, did you say figures? So like images, essentially?
Yes.
Yeah. Like I said, being concise, and just like with the visuals, avoiding the technical jargon is definitely important. But really, yeah, it's just that it's looking at the figure or the image or the visualization that you're trying to describe, and it's hard to explain this, but trying to put that lens on of the user with the impairments. So rather than showing a bar chart and saying this is a bar chart, really explaining the data points and the insights within that alt text as best you can. And I know this might not be the best answer, but it's essentially it's talking through the text to yourself and almost closing your eyes and visualizing it. That's kind of an early exercise you can do to kind of get you on the right way. But I know that's not very specific, but that's kind of like the general rule I follow. Is really, yeah, just the concise, clear language, but also being descriptive where it counts. So you don't want to be descriptive with, oh, there's 10 lines on this bar chart and it's horizontal. It's really focusing on the things you need to focus on and really painting that picture in your mind. And then obviously, like I said before, just really running it by people as much as you can to test it.
Yeah, we've been trying to make the I think the important part of the graph included in the header, so that you're not just saying what the data represents, like alternative payment models from 2013 to 2017, but you're saying alternative payment models have dropped year over year across primary care models. So the aha moment is in the header, and you're not relying on the folks who are looking at it to comprehend that or to like have to comprehend that. It's like it's right there for you. The other thing that I think I've been struggling with our organization in general is like the use of pie charts drives me crazy.
Me too.
Yeah, anything more than like 2 data elements in a pie chart, I don't think you should use, because you can't tell a difference. I love our finance people, and I haven't talked to them about this, but they presented to our staff the other day, and it had a pie chart that had like 35 different elements, and most of them were like 1/8 of an inch across the pie. And I'm like, I don't know which one. And there were 8 million colors, and it was just like, there's no way anyone can
That's that
comprehend
cognitive
that.
load.
Yeah, cognitive overload for sure.
Yeah.
Also, everybody stay away from 3D charts, please.
Yeah.
I can't even make 3D charts in my software, I think. So
Perfect.
and then I had another question. You mentioned this, and I come from a very international family, and I have never thought about this, but you mentioned making sure that the symbols you include don't have different meanings in different cultures. How do I learn that a symbol, like how do you even begin to learn not to include something?
I mean, well, you can actively educate yourself on it. that if you have time, most of us don't have that kind of time, but really it again comes down to really not focus testing, but really testing and not designing or building these things in a bubble, but making sure you're sharing it within your team, your organization, or whoever. And if you're lucky, like I am, I work with people from all types of backgrounds, all different backgrounds that are happy to share feedback and do's and don'ts. So it's something that, you got to be really careful with. Thankfully, I really don't get, I really don't get too adventurous with, the icons that I use or the imagery I use. So it's usually relatively safe, but it is definitely something that falls into that inclusivity.
Right. Thank you.
Mm-hmm.
Does anybody else have any questions? There's been some interesting commentary in the chat box, but no questions.
Yeah, I think the commentary around not using Tableau, I would love to either have a more accessible tool out there. We're actually in the process of looking at different tools because I don't know if everyone else has experienced this, but Tableau is raising our prices quite a lot. So if anybody's using a tool that's more accessible than Tableau, let me know. But then we also balance like, okay, is it more accessible to just provide the data in Excel spreadsheet? Because for me, it isn't. Like I am much better at looking at a Tableau report and being able to understand it better than it, because I'm not an Excel super user. And so that to me, that a Tableau is even more accessible than an Excel file. So providing multiple options for people to look at the information, I think
that's a really good point, because tables really are they lend themselves to screen readers much better than a Tableau dashboard. So yeah, I think it's really important to have those options for people to explore different channels, so to speak, to satisfy their need for understanding.
We'll have to look into the R+ Shiny. I've never heard of that one. I'm gonna write that down. I like it, Nicole. Thank you.
All right, so if anybody has any last questions, this is your opportunity. Otherwise, I have a few announcements. Going once, going twice. All right. Well, thank you, Carrie and Ryan, for your presentation. I learned a lot. Thank you very much. And thanks everyone for attending the session. There's a few short announcements. The slides from the speakers are available on the conference website. And also you'll be receiving a conference evaluation at the end of the conference. Please fill it out, even if you only attend a portion of the conference. It's super helpful. I'm part of the planning committee. We do look at what you say and try to implement solutions to the things that you raise. So we do read those and value those. There will be a raffle for everyone who completes the survey within 2 weeks. You could win one of two $50 gift cards. And then we have a 15-minute break now, probably actually about a 15-minute break. And then Dennis will be leading a day one debrief from 3:30 to 4:30. It's an opportunity to do some casual networking. And if you're a trivia person, there'll be some fun trivia. I love trivia, but I never get anything right. And I've just accepted that that's who I am. Otherwise, we'll pick back up tomorrow at 8:45 a.m. for the Emerging Leaders Showcase, which features 3 presentations from rising stars in public health on topics of equity and data, a new tool to support 2S LGBTQIA+ data autonomy, and advancing health equity through community partnerships. Hope to see all of you there. And then feel free to check the website for the remainder of the schedule. And yeah, thank you for joining us. Have a good day, everyone.